This truly is an exciting time in medicine. There are many technological advances, so many it's hard to keep up with them. Many of them consist of items which we treat our patients with daily to their advantage. One of them is nerve medication. There's 2 new nerve medicines on the market that actually can aid in improvement of symptoms and nerve regeneration. Also exciting news is nerve testing. We can now actually evaluate how many nerve fibers are in the skin, place patients on appropriate medication, and retest them to show that there's definitely an advantage. We're certainly proud of some recent publication that shows that across the nation, averagely physicians, including internal medicine experts, diabetologists, and podiatrists, have about a 52% approval rating for significantly alleviating their pain. We have learned that our office is at 74% positive results, which is nice to know that our positive reinforcement, our medicine, our new technology are helping our patients. Also new on the forefront of medicine is diagnostic ultrasound. That same ultrasound that you use to view your baby intrauterine is now available for injections, for evaluations of muscle sprains, strains, even early bone stress fractures, which would not show up by any other modality, will show up with a diagnostic ultrasound. We can pinpoint our medicine to the 0.5 millimeter, putting in just a small amount of medicine to have a large effect. Another exciting advancement is Arizona braces. These are braces which often come between 5 and 9 inches up from the floor, which stabilize your feet, your arches, and can allow you to walk better with less pain and oftentimes avoid surgery. I would say for every 1,000 braces we make, there's 10 or 12 which patients will say, still, I need something more, and then we can use our judgment in seeing if that patient would benefit from surgical repair. Another new interesting advance in healing is platelet-rich protein. In other words, we can, in the office, spin down your blood, save the best stem cells, the protein, the growth hormone, and inject that into an area we wish to heal. We can also make it almost looks like silly putty and put it in a wound, and it'll accelerate by several times your ability to heal. Oftentimes healing a wound that's been open for months, and we can oftentimes heal it in weeks. Simple but true, new copper socks, which have copper molecularly built into the fabric, kill 99% of germs, viruses, fungus, and bacteria. Another new surgical advancement is absorbable pins. These pins appear like a glass rod but dissolve over 1 to 2 years, oftentimes facilitating a better fix with less disability post-operatively. Many of our bone fractures, we will use a product called electric bone stimulator. This looks like a little iPod that you carry around, and it will actually place a basketball-sized electromagnetic field aiding in wound healing. Once again, bringing calcium, vitamins, growth hormone, growth stimulating factors to that area, oftentimes healing the fracture more certainly and quicker. TENS units, which many people are familiar with, stands for transcutaneous electric nerve stimulator. These devices, which are approved to place on patients' extremities in the office, will place an electromagnetic block, if you will, to your brain. So basically the pain you're feeling gets short-circuited so you can have an increased quality of life. Custom molded orthotics have undergone a recent advancement, and then we use laser orthoscanners. These devices, rather than using the old-fashioned casting material that gets shipped and possibly damaged through UPS and other carriers, can now be laser scanned. In other words, we scan every 0.5 millimeter of the foot, and a computer relates this information to our lab in Chicago, and a robot there fashions a wax statue of your foot and or ankle, and we build you a device to actually fit perfectly. This can be facilitated in half the time it used to, with less mess and to get you your product that you need to help you get on the road faster. This is only a small amount of the small products available. It is certainly exciting times, and we certainly strive to keep up with all the new medical advancements in our field.